Good afternoon, everyone. Happy Friday. Welcome to our what is usually our Friday virtual gathering. Today we have a very special event. Rather than our normal Friday gathering at PathPoint, we have converted this event to a vaccine town hall with a very special guest. We also have opened this up to other providers in especially the Bakersfield area. I'm sure we'll have some other folks joining us who aren't part of the normal PathPoint family, which we're grateful for and happy to share this information with them. So this is a different kind of event than normal, but we're very excited about it, and we have a guest that I'll introduce in a moment. For those of you who are not from PathPoint, PathPoint is a service provider in Kern County, as well as LA, Ventura, Santa Barbara, and San Luis Obispo counties. We provide day services and employment and residential ILS, independent living, and SLS, supported living services. We also have a behavioral health division. We have, when fully staffed, around 500 employees, and we support around 2,500 individuals. We currently have about 77% of our staff fully vaccinated, but we are very interested in having this event to support all of our staff, as well as the people we support, our families, the families of our staff. So this is something that folks on our staff ask for, and I think there's a lot of interest around the region, the country, California, and our services. So thank you for taking time to be with us today. And I just wanted to note two stats that I read about this morning. Many of you were kind of overloaded with some of the COVID stats, but these two things that came into me this morning were, I thought, particularly interesting. The first was that unvaccinated people make up more than 95% of COVID patients in American hospitals. 95%. So you keep hearing about hospitals overrun in Florida. They're putting people in libraries now on the floor because they don't have enough hospital beds. So 95% are unvaccinated. And the second stat that I thought was fascinating said that vaccines in the US, just in America, have already prevented 140,000 deaths and 3 million cases. I mean, 140,000 people. That's how many lives have already been saved by the vaccine. So I am very excited to introduce Dr. Jasmeet Bains, who is a physician, a board-certified family medicine physician at the Bakersfield Recovery, and she's also the medical director of Bakersfield Recovery Services. So she works with family medicine, but also is involved in substance abuse, addiction, and mental health rehabilitation. We know her because she is on the Department of Developmental Services Task Force, supporting efforts across the state. And she's also the board president of Kern Regional Center. She, in addition to these, and I don't know how she fits all this in, she is the commissioner and chair for the California Healthcare Workforce Policy Commission, a volunteer physician with California EMS Authority, and on the board of Global Family. She has many, many awards, including a 2019 Hero of Family Medicine by the California Academy of Family Physicians, Community Partnership Award by Taft College in Bakersfield, and last year she was the Rotarian of the Year by Taft Rotary. She has many outside interests, one of which we learned is restoring classic cars, including a 1940s Jeep that she just purchased. So I'm going to turn it over to Dr. Bains. Thank you so much for being here with us.
Hi, thank you guys so much for having me. Thank you for everyone that's in on this call. This is a very important discussion. Like Harry was saying before, vaccination is so super important to fighting this COVID-19 pandemic. Most of the people in the hospital are your unvaccinated population, and it really blows my mind when we have such a great vaccine out there, why we're having such high rates of COVID-19 outbreaks all over the country. So I hope my presentation today can help give some education around the vaccine. In no way am I trying to force a vaccine. I don't think that's the intention behind this presentation. We're just here to be educated on what the vaccine is. Sometimes people have fears that can be expelled if they understand how the vaccine came apart and that, you know, it's how effective it really is. So that's my message behind this presentation. So we can go ahead and get started, and then I'll probably talk for about 20-30 minutes, and I want to leave ample time for questions and answers at the end, and I want you to feel 100% comfortable to ask any question you have. Now, I'll be honest, I don't know all the answers, so if I don't, I will record it and get back to you. However, whatever I can answer, I definitely will. So we can go ahead and get started.
And one point on that, thanks for mentioning that, Dr. Baines. For those of you who aren't used to our regular meetings, there is a way you're going to have to put in your question through the chat. And there's a Q&A piece, so you can put in there, and there's, I believe, a button you can push to make your question anonymous. We're very happy to answer anonymous questions. So please, as she said, put in everything you can think of as we go at the end, and we'll get to as many as we can.
Yep. Alrighty, so we'll go ahead and start the presentation with the next slide. All right, I guess we've already been over this, so next. Okay, so let's go ahead and get started. What is COVID-19? We've been hearing a lot about it over the past year and a half. A lot of things have changed, and the real honest truth behind these past year and a half, couple years almost, is this was a virus that really took us by blindsight. We had no idea what to expect with this virus. We were seeing what was going on overseas, and we were kind of watching it. The reason we were watching it is so COVID-19 is SARS-CoV-2. Well, back in earlier 2003, 2004, there was a SARS-CoV-1 that everybody had heard about, and that was the SARS outbreak. And we were watching it, and it never made its way over to America. It kind of hit our southern border a little bit, but it really didn't make its way over to America. So we honestly thought the same thing would happen with SARS-CoV-2. We thought we could control it and it would not come over here. However, that was not true. The virus came over, as we all know very well, and it was really devastating for a lot of lives. What happened in New York, New Jersey, my brother is an emergency med physician. He was in the hotspot of New Jersey while this all went on, and as an emergency med physician, he got COVID. We learned so much about COVID since this past year and a half that we have much better information about what it is. And I think the biggest fear that people have right now is why is there so much misinformation? And whenever there's confusion, there will always be misinformation. And that is because some of the questions we really didn't know back then. We didn't expect it to come to America. We didn't expect it to be as devastating. This was a total wake-up call in the last year and a half, and there were a lot of newness, and I think that is why a lot of people were fearful of what was going on, because there were no answers. So COVID-19 is real. I have seen it through the eyes as a physician. I've taken care of many COVID-19 patients. I actually ran the Porterville ACS at the Porterville Developmental Center this past December and January as a physician. So I've taken care of many COVID-19 patients, and I can attest to you that it is very real. It is very debilitating, and we can't quite point a finger at someone and say, you're going to get sick of COVID-19 and you're not. So that is why we take such precautions as we do, is because I've seen people that are very young and healthy go very south with a COVID-19 infection. And I've seen people that are old and not very healthy and do well with COVID-19 infection. So there's a lot of newness around this. And I think taking this seriously and protecting ourselves is what's really going to save a lot of people from dying from COVID-19 and in this pandemic. So how does it spread? It spreads in the air when you're close to an infected person who is exhaling the small droplets. And then having these small droplets and particles that contain the virus can land on your eyes or nose or mouth, especially if someone coughs or sneezes. This is why wearing a mask is so important. Touching your eyes and nose or mouth that have the virus on it can lead to you being infected by COVID-19. Now, why is a mask so important? That's what a lot of people ask. And a mask protects your most vulnerable part of your face, the part of your face that is going to infect you with COVID-19. And that's really your mucosal surfaces. So anything wet, so your mouth, your nose, these places are where the virus attaches to and attacks. So a mask is very effective at preventing that to even enter your mucosal surfaces, which is where the virus kind of latches on and spreads. Next, please. So what can we do? Exactly what we've been telling everyone. Wear a mask, stay 6 feet apart, avoid crowds, get a vaccine. I think at this point, I think honestly, as a physician, we declared victory a little too early, and a lot of physicians were a little hesitant when around March, April, May, we were like, oh, no more masks, everybody. And a lot of us physicians were like, I don't know. We're really not, cleared yet. We were hopeful, but we were wrong. So next, please. So COVID-19 vaccine. Key things to know. Now, the biggest question people ask me about fear behind the vaccine is this thing was created so fast. I don't trust the government. They do lots of crazy things, and I just don't have trust in them because this came about so fast. And how did you guys do this? And my biggest answer is the same I've been saying ever since the vaccine was developed. If you look at the history of research, and I do a lot of research on my spare time, we as a country were not putting effective money, manpower, and teamwork into research for the past decades. Breast cancer research, diabetes research, we have not been putting in the money behind effective research. And I know this firsthand by how many research projects were cut because of funding. COVID-19 was a specific spotlight in healthcare where so many people worked on this vaccine. You had everybody drop everything. You had a powerful example of teamwork, of effective research funding, and really that miracle is really what happens when you research and fund research projects appropriately. You had so many people on the table working with the vaccine that honestly, a year, it should have been out within a couple of months, in my opinion, with how many people had their focus and lens on this. So don't be fearful of the fact that it came out so fast. Be really grateful for the fact that we dropped everything and put all effort on this vaccine. And I can attest to it as a person that does research that I've never been funded fully for any of my research projects, and they get longer and longer, and sometimes they don't go the way we want. And my biggest question is, if we had taken all that support and funding behind the COVID vaccine and we do it behind diabetes research or cancer research, God knows what miracles we could come up with. So don't be fearful of the fact that it was so fast so soon. Be grateful for the fact that we had so many eyes on this and so much funding that we were able to create a vaccine. And that just goes to show what we can do. It was a true miracle. So COVID-19 vaccines are safe and effective. You can have, so now the next most common question is the side effects. So And that goes back to your basic immunology. Any person that has an intact immune system, anytime you inject anything into them, especially a vaccine, your body is going to react. Your body is going to react and start testing and seeing what is this, and it's your own immune system that gives you those symptoms of tiredness, headache, and it can even cause your body temperature to rise as your body figures out what is this that you just gave to me. And that's an appropriate response. That's what you want to see from a vaccine. You want to see that your body is reacting. Now, you don't want to see some side effects, and I will go over that later. However, your body responding to the vaccine is an important element to you building your immune defense towards COVID-19. And it typically takes 2 weeks for your body to build the appropriate antibody response for that. Go ahead, next slide. So just want to, I know there's a lot of words on these slides. I'm just having these here, so if somebody wants to come back and get accurate information, they can. All of this information is from CDC, Public Health Department, and the ACOG, the American College of Obstetrics, because those have the most up-to-date information. We don't need to go into all of it. I just wanted to go over a couple of the vaccines. The first one's Pfizer. Pfizer comes in 2 shots, 21 days apart, and right now it's recommended for anybody 12 years and older. So next slide. The Moderna vaccine also comes in 2 shots, and this one's 28 days apart versus Pfizer, which is 21. And this one is only recommended for people 18 years of age and older at this time, which they're still studying. It might change and any day. Now, the other important part is Pfizer, Moderna have almost the same efficiency, about 95–94% effective on preventing a COVID-19 infection. Next, please. So the Pfizer, Moderna were your mRNA vaccines. What is an mRNA vaccine? So an mRNA vaccine is a new technology. However, it is what we consider in science a more efficient and better technology. In the past, what we used to do was take viruses and weaken them a little bit and then send it to your body for your body to react. We don't do that. What we do instead is we've created a messenger RNA that we introduce into your body, and it tells your body how to produce this spike protein. So when your body produces the spike protein, it goes out into your body and your body learns to build an antibody against that spike protein. Now, the reason it's called coronavirus is because it has all these spikes on the outside, and it's supposed to be a crown. So it's the word for corona, as everybody knows, is crown. So those little spikes that are on the outside is what your body develops an antibody to. And the messenger RNA is basically a little piece for your body to learn how to make those spike proteins so your body can build the antibody. Now, the vaccine does not contain any virus in it. I want to make that very clear. And it definitely cannot change your DNA in any way. It doesn't even go anywhere near there. Next slide. So the third one, Johnson & Johnson, is another vaccine, and this is your 1-shot vaccine. And this was created a little differently from Pfizer, Moderna. It's not your mRNA, it's a vector vaccine. I'll go into that in a little bit. And this one is a 1-shot in your arm, and you're good to go 2 weeks after. And this one's recommended for people 18 years and older. Next. And how does a vector vaccine work? So this one uses a little bit of the older technology that we used in the past, where we don't, first of all, it's not COVID-19. It's actually the adenovirus. Adenovirus is kind of like a similar virus, but a very, very common virus. It doesn't do anything, causes no side effects whatsoever, and they use a piece of it. So there's no live virus in any of these vaccines. I want to make that clear. They use a part of the adenovirus, and what that does is it does the exact same thing as mRNA. It's a different way to do the exact same thing, where it introduces it to your body, and your body learns to make a spike protein, and then your body's develops natural immunity by building antibodies to that spike protein. That's it. In no way are we injecting you with a virus or the coronavirus as well. It also cannot make you sick from the virus that is used as the vector, and it cannot change your DNA in any way as well. Next slide. So when have you been fully vaccinated? You're considered fully vaccinated 2 weeks after your second dose of Pfizer Moderna, or 2 weeks after a single dose of Johnson & Johnson. So the key term is 2 weeks after your final dose. So in that time, you have to still adhere to all precautions, masks, 6 feet apart, everything. And what's happening is when the vaccines were being rolled out, they weren't very clear in that messaging. So a lot of people within a couple days after getting the vaccine were going out, not wearing a mask, and then they got coronavirus. And then they're like, oh, it's because the vaccine failed. No, the vaccine worked. It's because you were supposed to adhere to guidelines 2 weeks after so your body can develop the antibodies to the coronavirus. Next, please. So common side effects. So what I've experienced, I've given lots and lots of vaccinations for coronavirus in addition to others. On the arm where you got the shot, pain, redness, swelling, we recommend applying a clean, cool washcloth over the area, and moving your arm around a little bit can also help if that doesn't hurt too much. And then throughout the rest of your body, you can feel tiredness, headache, muscle pain, chills, fever, nausea. And for that, we recommend drinking lots and lots of water. And really, if you have any of these symptoms, please consult medical evaluation right away, but also, you know, be at ease that a lot of these are just your body reacting and creating its immune system to coronavirus. But never refrain from gaining medical advice. If you feel odd, please see a provider, physician right away. Next, please. So basically, this is what do we need to know? So vaccines are safe, they're effective, they're helping to keep people healthy. And that's the most important key take-home message that I want to give out. Is they are safe, they are effective, and please, please get vaccinated, because we cannot tell who's going to have an adverse effect from the coronavirus. You cannot say, oh, I'm young and healthy, I won't get it. And a lot of reasons is you might have an illness that you don't know about. You might think you're healthy, but you're not. That in and of itself means protect yourself as much as you can. Next slide, please. So the COVID-19 vaccine can help you from getting seriously ill. Now, what was being displayed earlier was that a lot of the people that are not vaccinated are the ones in the hospital right now. So if you have the COVID-19 vaccine, it's not 100% that you will not get coronavirus in SARS-CoV-2 in the future. The thing that it does is it lessens your risk almost by 95%, as I said before, for the Pfizer and Moderna. But there's always that 5% chance that you can still get it, right? So with you're basically giving your body the best chance it can to fight off a coronavirus infection. Now, let's say you got vaccinated and then you got sick. You possibly can, like I said, that 5%, but what we're seeing in those patients is they're not even that sick. they aren't in the hospital, first of all. And second of all, it decreases from a 7-day course to maybe about 2 or 3 days. And that's the same thing we saw with the flu vaccine. Whenever you would go in to see your doctor would be like, get your flu vaccine, your yearly flu vaccine. You would say, no, I don't need that, I don't get sick. Well, the flu vaccine was used because it would decrease, if you did get the flu, it would decrease the amount of time that you were sick as well. And it's the same thing that's happening with the COVID-19 vaccine. Next slide. So the other question people ask me is, I'll get it and I'll let my body build the immune system and that's the best immune response. First of all, you're wrong. You getting coronavirus and developing an immune response is not as effective to protect you as the vaccine is. So again, even if you've had COVID-19, still get the vaccine, because the vaccine teaches your body to develop the best immune response and it protects you the best, even for people that have had COVID-19. The vaccine is that effective. So that's why I always recommend, even if you've had COVID-19, please still get the vaccine when appropriate, when you're not sick. We wouldn't want you to get a vaccine if you're sick. Now, the other thing that I see as a physician is the long-term complications of COVID-19. And this is something that I say all the time. COVID-19 is not a virus you want to become immune to naturally, because this virus is very detrimental to your health. I see such long-term complications from COVID-19 in my office. I have patients that are still exhaustively tired 6 months after a COVID-19 infection, called the long hauler syndrome. We've seen people develop really bad heart disease from COVID-19, in addition to what it does to your lungs. Some patients will develop long-term lung problems from a COVID-19 infection. And then there's lots of reports of it affecting your brain, your kidneys, other parts of your body. So to people that tell me I'd rather get COVID-19 and let my body deal with it on its own, I kind of wish you would shadow me for a day to see these patients that have had COVID-19, and you will change your response to that very quickly once you see the long-term complications that I see on a daily basis as a physician taking care of COVID-19 patients. Next, please. So a couple of questions that were asked earlier. Can receiving a COVID-19 vaccine cause you to be magnetic? And all these answers are from the CDC website. No, receiving COVID-19 will not make you magnetic. Including at the site of the vaccine. There's nothing in there that creates that. Can a COVID-19 make me sick with COVID-19? And we discussed that. None of the authorized COVID-19 vaccines in the US contain the live virus that causes COVID-19. That means that a COVID-19 vaccine cannot make you sick. Now, you might have side effects, and we had discussed those earlier. Is it safe for me to get a COVID-19 vaccine if I would like to have a baby one day? And the answer is yes. If you're trying to become pregnant now or want to get pregnant in the future, you can get the COVID-19 vaccine. So the other part is, I want to put your mind at ease a little bit. America has lots and lots of steps to get anything approved. We not only have CDC and the Public Health Department, you have different medical societies that see what it is that this vaccine can do, and they're really held accountable. And they're not going to approve something if they think it's going to hurt the lives of patients. So the American College of Obstetrics did much ample research into the COVID-19 vaccine, and they came out with a statement saying it's safe in our pregnant patients. It's safe if you're breastfeeding. And they actually say, please, please get it if you're pregnant or breastfeeding. Next slide. Can it alter my DNA? Nope, it cannot change your DNA in any way. Both mRNA and viral vectors, as we discussed, deliver instructions to our cells. It does not even mess with your DNA. We'll get will getting a COVID-19 vaccine cause me to test positive for COVID-19 on a viral test? Nope, because it doesn't have COVID-19. Do COVID-19 vaccines contain microchips? Nope, sorry, it doesn't. It really does not. And I can say that for a fact. I've given out a lot of the vaccines myself. Doesn't have any microchips. I'm not really sure where that came from. Next, please. And then there was a question about the sodium level in the vaccine, and I actually have never gotten that question before. So I included this slide with the ingredients of the Pfizer, Moderna, and Johnson & Johnson. So this is a list of the full ingredients in the vaccine, and you guys can definitely look up more information on the CDC website. The only thing is where it says here is sodium chloride. So first of all, there's no preservatives in any of these vaccines. What it is it helps, we add certain elements to it so that your body doesn't destroy the vaccine when we inject it into your body. So normally, if we were to inject it without anything to balance out the acid, your body would just destroy it. So we put in a little bit of sodium chloride to help make sure that that doesn't happen. Now, that's not new. That's been in all vaccinations and any injection. Really, if you get like people that get steroid injections in their knees or any type of injection really that you got, we balance out the acidity in the body to make sure that your body doesn't just destroy it. And that in no way can affect your sodium levels or anything else. Next. And then this is just more information from the American College of Obstetrics on the COVID-19 vaccine during pregnancy and breastfeeding. And yes, yes, yes. Next slide. And then how do I get vaccinated? So myturn.ca.gov is where you can go to find your appointment for the vaccination. I highly encourage you to utilize this website or check around in your community. But this website is all key to all COVID-19 vaccinations. It's a great site to go to for either your first or your second, or as the announcement might come out sooner, is a booster shot. Once that might be available. Right now it's available for anybody with immunosuppression. However, they are considering as of this week to make that open to everyone that's had the vaccine 8 months ago. So keep this slide, myturn.ca.gov, because you might be everybody might be visiting it soon. Next slide. And then these are just the sources for my presentation today. And next. All right, I wanted to talk about 30 minutes. I went 4 minutes over. So I wanted to leave ample time for questions. Like I said before, please feel free to ask any question that's on your mind. And like I said, if I don't know the answer, I will definitely get you that answer.
Great. Oh, that was terrific. Thank you so much for answering so many of the questions that we sent ahead of time. I would say I was watching the questions as you were talking, and they were coming in with some really good ones. So people are paying attention, and they have some tough ones and some good ones for you. So here we go. Should we prioritize sanitizing surfaces, such as pens and papers that are passed hand to hand, or is the virus not likely to spread that way?
Yes, it can spread that way, and I'll tell you why. If you have a pen and you cough on it, you just spread COVID-19 onto that pen, and then you pass it over to someone else. So yes, sanitizing is very appropriate.
Great. And do you happen to know if we receive the J&J shot, will we have to get a booster?
So no, that's a great question. No, at this time, they're not recommending a booster for the Johnson & Johnson. However, keep your eyes peeled because I'm not sure. A lot of things are changing weekly. So at this time, no, but that might change soon.
Okay. Great. So we'll keep on that one. A question of can you define safe when used to refer to the vaccine?
Safe. Repeat the question, please.
Yeah, can you I guess they want more information about what you mean when you say the vaccine is safe.
Good. Okay, so I think what the question is asking is what I consider safe and unsafe. And if I'm wrong, please type in the chat if there's something specific. So vaccines right now are safe, meaning that the majority of the population will not have an adverse reaction to the vaccine that can cause death or mortality. Safety is always something that America has taken very, very high standards for. Now, that's a great question because I wanted to touch upon the fact of the emergency use authorization for the COVID-19 vaccine. So a lot of questions that I'm asked is, what is an EUA, emergency use authorization? Why isn't it FDA approved? And the reason is because FDA approval actually means that you have warranted clinical evidence that this vaccine has not affected so many people and caused a high profile risk of mortality or adverse effects outside of the normal effects, like I said, the myalgias and tiredness, which is your immune system. So because we did not have time to adhere to that, we had to use an emergency use authorization. And that means we are in a state of emergency and we have to, at this point, get this vaccine in as many arms as possible. And that's not to say that they didn't do clinical trials. They definitely did clinical trials. And they definitely had a lot of numbers on that because you had so many volunteers that jumped on board. It just means that the regular FDA approval was not gotten because that often takes 5 to 6 years. So the EUA is an emergency use authorization. However, the studies that came out of the clinical trials on the vaccine did prove that it was considered safe to use in the general population. Hopefully that answered the question. If not, type out what they meant.
No, that's great because I know that was another question that a lot of people have. So I'm glad you got to that. All right, I see over 20 questions backed up. If enough people get vaccinated, will we ever be able to go back to the way things were? Is there hope for that?
Man, this past year and a half has been so terrible, and nobody wants to go back to normal more than me right now, to be quite honest. I hope. I really, really hope. It's a very hard question. There's so much behind that. I mean, so many people have lost their lives. So many of my colleagues have lost their lives. And there's nothing more than we want than to get rid of this thing. Will we ever get rid of it totally from our population? I don't know, and I'm leaning towards no, because this virus doesn't act in accordance to anything that we've had in the past. It's new and we're still learning day to day. So unfortunately, I don't have an answer to that question. I hope, I pray. I am a very religious person and I pray all the time, and I hope and pray that we can go back to normal. I really do. I really do. But we just don't know. It's too early for us to know at this time.
Okay. Yeah, thanks. Very honest answer on that one. Appreciate that. There's a question about a recording, and yes, we will be sharing the recording when we're done. Dr. Baines allowed that, so thank you for that. How important are booster shots?
Another great question. So what studies are showing right now is that after 8 months of getting the vaccine, our immunity to COVID-19 is not as effective as the 2 weeks after getting the vaccine. So the booster shot is very important. I personally got the vaccine early. I got it in December of last year, so I'm way past the 8-month mark. So I will definitely be getting it as soon as it's available. because it does help provide some immunity where we are seeing that immunity fading after 8 months of the vaccine. So yes, it is very important.
Great, and we've heard those are coming in September, so we'll certainly keep everyone aware of that. What role do children play in spreading the virus since they can't get vaccinated? And we're talking about children under 12.
So, like I said, things are changing week to week. Right now, they are doing studies to make sure that it's safe and effective in people under the age of 12. And, you know, and the reason why it's taking so long is we don't want to play around or risk the lives of our children. Nobody wants to do that. Neither do we want to play around or risk the lives of anybody. A lot of the steps that we're taking is to protect your health and your safety in mind, and rest at ease. Once the studies are showing that it is effective, they will make sure that it's available for kids under the age of 12. At this time, kids are not considered the super spreaders of the virus, so it's safe to say that they should be okay as long as they're adhering to all of the guidelines, wearing a mask, and mask is only for kids 2 years of age and older. No kid under the age of 2, please. So it's really hard to say when that will be available for them. Hopefully soon. However, now the other side to that coin is our kids with developmental disabilities. We're at a higher risk of mortality as a child from COVID-19 than any of the other population because of the fact that we have a weakened immune system. So any child with a developmental disorder or an intellectual, please consult with your physician, and please be very strict to the guidelines. Don't gamble with your life right now, please. I can't stress that enough.
Yeah, thank you for that. We're seeing comments come in of people kind of talking about their own challenges with COVID and backing up your thoughts on that. What's the best vaccine to take? And then aligned one with that is a question about, does the vaccine affect your arteries in any way? In other words, why are there so many blood clots that seem to be connected with COVID-19? So that's a 3-part question.
What was the first part of the question again? I
forgot. What's the best vaccine to take?
Perfect. So great questions again. I'll be honest, the best vaccine to take is the one you can get right now. Whatever you can get it. I think that's the most important message that I want to give out is they're all 3 of them are safe and effective. Now there's a lot more other vaccines out there which America has not given the emergency use authorization, and that comes after multiple studies and finding out if it's safe or not. So these 3 are not the only vaccines to COVID-19 in the world. There's a lot more, but these are the only 3 that we've studied and we feel are safe for our population. Like I said, nobody wants to gamble with any life. All lives are precious, in my opinion, in everyone's opinion, really. And what was the second part to the question?
Then there's a question about affecting your artery. I think these are kind of combined, but it's a question about the blood clots that showed up. At some point, we paused the J&J vaccine because of blood clot concerns. And so wondering if it's because the vaccine affects your arteries, or what do you know about the blood clots?
So that's another great question. They paused it, they studied it, and then they restarted the vaccine because of the fear around it. Now, I want to point out one caveat. Never in history have we ever mass vaccinated so many people at one time. So the thing is, with that caveat, we have to understand that side effects that were purely left under coincidence versus the vaccine can happen. You might have a lot of people that developed blood clots because they were predisposed to that, regardless of getting the vaccine or not. Now, studies they're studying it, and studies right now are showing that they are not adding to a blood clot. However, people that were predisposed to a blood clot before might develop a blood clot, not because of the vaccine, but because of their health status now. And that has a lot to do with going to your doctor and making sure that you are in the best of health. A lot of people, unfortunately, over this past year have forgone seeing their doctor or getting their health care. So there's more of a reason why you should be going in to seeing your doctor. As of right now, the studies are showing that they are safe. But the caveat is, of course, not everything can be related to the virus, to the vaccine, sorry. However, we are studying everything and taking it very seriously.
Yeah, thanks. And I think the data is showing that the percentage, your odds of getting a blood clot through a virus are so much smaller than through a vaccine, than your odds of just getting the virus and having some of those effects you talked about earlier. This is a question I've seen actually a few times, so I'm glad it was asked. What about the fact that there aren't any long-term studies? Many scientists were on this to create it quickly, understood, but it wasn't studied on people for very long since it was just released in December. So there's concern that there might be some side effect that will show up after multiple years that you had the vaccine.
It's a great question, and of course there's concerns around that, and we don't have, unfortunately, a crystal ball to look into the future. However, I think it was all about mitigating risk, and the risk of getting COVID-19 right now and dying from an infection was much worse than getting a vaccine and living for future ramifications of the vaccine. Now, I don't think anybody can tell you if there's going to be long-term complications to the vaccine. However, I can tell you from a person as a physician giving many vaccines throughout my career, vaccines aren't new. We've been giving vaccines for a very long time, going back to polio, going back to tetanus. So vaccines have been in our society for a very long time, and they've been shown to be effective and safe. So it's really, it's a hard question because we don't have our crystal ball, but we have our past record with vaccines to fall back on, and we're seeing that our past vaccines were safe, so we're going with that. Sorry, I hope I answered the question right.
I think it's a very fair answer. I mean, we do what we can is look historically and project it to the future. This is sort of related, I guess. Why don't vaccine manufacturers have legal liability if you suffer severe adverse reactions or any reactions at all? I don't know if you answered that one.
I became a physician. I don't know the legality behind a lot of this. I'm sorry. I don't think I would be the right person to answer that question. Maybe this will make me go into law one day. I've been thinking of that.
We need a lawyer on the line for that. Someone keeps insisting there are fetal parts in the vaccine. Is that true?
So no, that's not true. I think they're referring to when this was a concern earlier this year, and that's been disproven. And I do know there was somebody that had spoken out against it, but they had taken their statement back once they were given the proof that it wasn't. I can't remember who that was, but no.
It was actually part of the Roman Catholic Church.
Yeah, you're right.
Initially it said don't get the vaccine, and then they learned more and said it's fine. Yeah. Yeah, no, good answer. I'm glad you remembered that piece. This is an interesting question. I did get COVID-19, but still my taste is not really back to normal. How long does it take to come back to normal?
We're seeing it can be up to 6 months. It could be longer. We really don't know. We really don't know. More of a reason why you should get the vaccine and not get COVID-19, really. But yeah, we really don't know how long that can last. Most people regain it within 6 months, though.
And then they asked if is there a medication someone can take to get their taste back?
No, I know I've seen a lot of these TikTok videos about the burnt orange, and no, that's not true. Please don't create more fires than we need right now, please.
Yeah. Thank you. Here's one. Can you explain the differences between COVID and influenza for the flu? How are these different?
Versus the symptoms, or?
Yeah, like I've heard people say, boy, COVID is just like getting the flu, so you shouldn't worry that much. Why is COVID different than the flu?
COVID is much more lethal than the flu. I want to stress that very, very much. It's more contagious too. And COVID-19 spreads so fast in people. Flu does not spread this fast. So if you take a room full of 100 people and you throw influenza in there, you're not going to get that many people infected as if you took a room full of 100 and threw COVID-19 in there. So just by biostats, I know that can be an overwhelming word, but just by using a little bit of stats, if you infect 100 people, and this is going to be, 100 random people in the room versus 100 people with influenza, you're going to have 100 people have much more severe reaction to COVID-19 than the flu. So no, it's not the flu. It's much more detrimental. There's a lot more long-term complications from COVID-19, which I had gone over before. And it's a very, very severe illness. I've held the hands of patients that have died from COVID-19. And I have to tell you, it's a very bad way to go. If you are in a room, you can't be with anybody, only thing you have is an iPad with your loved one and a physician at your side with this huge getup of PPE on, and that's your last image in your brain. So I didn't make that comment to create emotion. I'm just giving you a real picture of what I've seen as a physician in COVID-19. It is a very real virus causing a lot of detrimental deaths in this country. So please take it seriously.
Yeah, thank you. I think that's a really important thing to say because I've heard that before, and it's more lethal, it's more severe, and it's more contagious. And it's heartbreaking, the stories like the one you just shared about being there with people dying.
It's a very, very, if I could speak on the behalf of our healthcare workforce for a second, I think we're tired, we're exhausted. We've been fighting this for a year and a half. We keep hoping that it's going to get better, and it's not. And then when we hear of people that are not getting vaccinated and now they're showing up in the hospital again, it's really exhausting knowing what we've experienced before, and people's lives could have been saved with the vaccine, and they chose not to get vaccinated. Now they're fighting for life on ventilators, unfortunately.
Yeah, and you see a lot of those stories in the news too. People saying, boy, I died, my wife is dying. I saw one where their last words were, please get my kids vaccinated. We have a lot of questions. We're not going to get to them all in the next 5 minutes, but we'll do our best, and we'll save the questions we don't get to and see if we can answer them offline or find the answers and bring them back. Here's one. How long after receiving either dose of the vaccine do the symptoms typically last, the side effects?
About 3 to 5 days. I'll give you my personal story. So the first shot, if you're taking the 2-shot one, the first shot is just a smaller dose of the second shot. So after your first shot, you shouldn't have too many. It's really the second shot that you're going to have about 3 to 5 days. I was pretty much knocked out for 2 days. I was really tired, really exhausted. I had the chills. I had elevated temperature for about 2 days, and then it went away. So, and that's typically what we see, about 3 to 5 days.
Yeah.
But
great.
definitely consult with your medical professional if you have any symptom.
Yeah, I think it's different for everybody. I felt I was tired for a day and then felt fine, where my spouse was sick felt bad for maybe 3 days, and then she felt better.
Yep, and that's just the immune system reacting to, everyone reacts differently according to their immune system.
Yeah. Yeah, in fact, the first one was worse for me than the second one, so it's so hard to know. Here's a question. I had COVID at Christmas and have long-term fatigue. I'm scared that if I get the vaccine, it could make me worse.
So I would definitely consult with a medical professional for that person, 100%. Make sure you're talking with your doctor on that, because there's certain things that we can test you for to rule out what your fatigue really is due to. So please see your doctor on that.
Yeah, good question there. And some of these other very specific questions like sodium in the vaccine, and you have a high sodium issue, is good. Go to your physician. Will the booster be the same product as the first vaccine?
I don't know, actually. I actually don't know. I'm thinking it is, but I don't know the answer to that.
Okay, and then a question about the Delta variant. How effective are they to the Delta, and what's going to happen with the next variant? I don't know if you can, how far you can see in the future.
So it's hard to say, and that goes back to my initial hope that this goes away. I really hope I can just close my eyes and everything goes away and goes back to normal. However, we just don't know. They are showing to be very effective against the variants, and that shows because most of the people in the hospital right now are unvaccinated. So that means that people that were vaccinated were showing good response to the variants as they were going through. So far we are seeing that they are very effective against the variants. The problem is people are refraining from getting vaccinated right now.
Yeah. All right. Thank you. I think we have our last few here. How can you be certain of the side effects and the long-term effects of a vaccine that hasn't been tested for a prolonged time period? What will happen in the future? I think we sort of answered that one earlier, of saying, boy, we look at the past and see our long history of vaccines in this country and where we're going. Yeah, you're nodding on that one. This one says, I had COVID earlier this year, and I can attest to that is true that you're saying about the memory issues and other physical issues I've been experiencing. I'm not sure what that word is, something that my cardiologist is monitoring on my loop recorder. So I think just a comment of how severe some of these long-term things are.
They're pretty severe. The heart disease, the cardiomyopathy, the fatigue, the brain, lung damage. To any person that tells me I'd rather just get COVID and deal with it, please spend 1 day with me seeing my patients. You will change your mind very quickly.
Yeah, and I think that actually goes to this next question. It just disappeared, but it was basically saying, well, you could, the odds of getting COVID, how do the odds of getting COVID compare to the odds of having a reaction to the vaccine? In other words, someone saying, boy, I could get a reaction to the vaccine, or I could get COVID. Maybe I'm not going to get COVID, you know.
And that's hard to say because, like I said, there's young, healthy people that are dying, and there's old people with a lot of health issues that are doing fine. So it's really about protecting yourself as much as possible, and making sure that you're giving your body the best defense it can against being attacked from this virus. It's not the flu. It's a very seriously debilitating illness. Lots of people that are dying daily from it and being infected with it. It's not something you want to become naturally immune to. And I don't know the exact answer to the odds, and I don't want to speak on something I don't know about. All I can do is plead with you through the eyes of a physician that's lost a lot of patients and colleagues. This is real. It's debilitating. Our healthcare workforce is exhausted beyond words. Please don't gamble with your life.
Yeah, that's a great statement. I see we're right at 3 o'clock. There was a question of whether we need a vaccine every year, like the flu vaccine. I don't think we know yet.
I would see we probably it might become like your yearly flu and COVID-19 vaccine. It might become part of that.
Oh, interesting.
Yeah.
So it might come together. The last few comments here, and they all have a lot of thumbs up on them. I'm just going to read them. Thank you so much. So knowledgeable. The next one, not a question, just want to say thank you so much for being so thorough and detailed about informing us about this. It is much appreciated. Thank you. Thank you so much for taking time out of your day to give us this great information. And I'll join with them. We had over 100 people on, and I know in our situation, a lot of times we have one computer and a bunch of people sitting around, so it's quite a bit more than 100. But thank you so much, Dr. Baines. This was incredibly useful. I mean, I thought I knew a lot of stuff, and I learned and was taking notes and learned a lot from what you had to share. And I appreciate not just the time you've taken with us, but the effort you're putting into saving lives, which is what this is all about. And I'm sure through this hour today, we've saved some lives. And I know you're doing this every day. Really, really appreciate it.
Well, thank you for having me here. And I also want to give this disclaimer. I have no recusals. I don't get paid by anyone to do this. I am just a physician trying to protect my community and give you the highest level of information that you can. If you have any other questions, please see your doctor or your provider, and definitely work it out with them with your medical issues. They can address it as much as possible. So please do not hold back on your healthcare at this critical time.
Yeah, thank you. No, that's great. And we did have more questions than we could answer today. So we'll go back and look at those and see if we can find answers and follow up to the best we can. So thank you, Dr. Baines. Thank you, everyone, for taking time today. Really appreciate your spending the hour with us. And we'll see you all soon. We'll share the information about the recording of this as well. Thank you, everyone.
Bye, guys.
Thank you.
Thank
Bye-bye.
you.